everybody for coming for this event. It is extremely one special one because it's the first time we're doing something like this, and it is the first time we'll have an interaction that is very, very not happened before. It's the first time we're doing something like this. So we want to be very, very cognizant of the fact to explain this first. What is a patient summit? A patient summit is basically a concept where we are getting 6 top-notch glaucoma surgeons, clinicians across the country to sit and discuss with patients themselves or their families. Because a lot of times, and I'm sure all of you have gone to the doctor's clinic even at least once, you don't actually get the time to spend and think, what are my questions, what are my doubts, how do I handle this at home? These are doubts and questions in patient's mind and it's left. Where does the patient go? They end up usually going to Google, they'll usually call one of their friends. This is what really happens. It is the most often order. We want to break that monotony by actually calling them for an event. This event we are holding for the first time. It's called Agarwal Patient Summit, and we are holding it for glaucoma patients for the first event. There are many more to come like this, hopefully with the thought process that the interaction between patient and doctor becomes more friendly, becomes more cordial, and can be more honest with all the approaches that is happening. Now, Glaucoma Patient Summit is happening on 29th of March, 3 p.m. to 6 p.m. in ITC Grand Chola. So we are even doing it like a high tea. So it's not just an event which is done, in the consultation chamber. It is done as a conference would be actually held. It is basically a conference between the doctor and the patient, which has never been done before. We want to start this and do more diseases like this as we go along. We've already planned our next 2 events, but I think this one actually shows the way where we want to go. In the Tamil, so I'm going to ask one of them to speak very soon. But the idea and the thought process of Glaucoma Patient Summit, lot of times, நம்ம வீட்ல family இருக்கு, அப்பா அம்மா, they'll have glaucoma, but we don't know what they're going through. We really don't. We are so busy in our work. We are just doing our work and they're doing their drops, medication. Emotionally, what are they going through? We don't know. How to take care of the emotional side of things. How to take care of the home care. வீட்ல என்ன பண்ணலாம் to reduce this burden. This concept will only come alive when we have doctors and patients talking to each other without the setting of a hospital. So you take the hospital setting out and then make them talk. The talking will explore a huge element. I'm sure all of you relate to what I'm saying. It may not be for glaucoma. It may be for something else. It could be for diabetes. It could be for diabetic retinopathy. So many such conditions, vision loss, could be many things. The thought process has always been to educate and empower the patient. Empower the patient to make better decisions. Show them what is happening in this world of glaucoma from our eyes. So they are also aware, oh, something new is coming very soon. Oh, it might actually be better for me specifically. There could be specific, let's give an example, low-grade glaucoma. You can actually go and do a procedure and get rid of all the drops medication that you are using. Just a low-grade glaucoma, you can do a minimal invasive glaucoma surgery and get rid of all the drops. We showed this in the last time we all met. MIGS was something that we were speaking about, where a patient also came and spoke about who he was on drops for 10 years and now 0 medication. Just imagine the emotional side of how good it is for that patient to start doing his work without needing to put drops in his eyes. So this thought process, if we can communicate to our patients, I urge all of you to please put out one phone number which will really help the whole scenario. 95949-01868. I repeat, 95949-01868. If you call this number, they will help you register for this event. It is a paid event. We are only charging 99 rupees. Basically, it is nothing. The reason we are charging is only so that we filter off only glaucoma patients. Otherwise, we don't want patients who don't have glaucoma to come for this event. Has no meaning. Does not serve the purpose. And we are also today introducing to everybody all those patients who upload a glaucoma file, report of anything will get free registration. Today we are launching that also on the website. There is a website which we will mention, but if you go to the website for Glaucoma Patient Summit, if you upload your files, the charge is waived off. It is completely free for glaucoma patients. Second, we are also launching from tomorrow, 27th March, for the next 1 week across all centers of Agarwals, free consultation for glaucoma for 1 week. Because this month was also the glaucoma week. This month we had it from 13th last week. So I want to urge everybody who having glaucoma, or parents who have glaucoma, or grandparents who are having glaucoma in their household, please register for this event. It is on 29th March, 3 p.m. to 6 p.m. in ITC Grand Chola. If you register, you can come in. One very important thing, Agarwal network is about 170 hospitals large now. We are also having this region-wise in specific locations, live telecasted, so that even those patients can go and sit in our branches and talk to the doctors in the branches. So this is happening in Mumbai, Punjab, Kerala, in Hyderabad, Bangalore, as well as in South, in Coimbatore and Salem. So we are doing a lot of work towards an event like this, and hopefully with all your support, I can assure you it will be not just a success for glaucoma, but for a lot of the other diseases that we are coming out with this educative format for patients and doctors to interact. So it's the first first of its kind. Nobody has done this before in India. We want to be the first ones to actually execute something like this at a large scale, live telecasted. We already have 200 people registered. We want actually as many as we can get, because this is the only way that we can educate patients without the setting of a hospital, without the pressure of or the fear that is involved with this disease. I'm going to hand over to Soundri to talk to us